yesterday's panel, we brought you the story that the Victorian State Government has been forced to admit, following detailed questioning from the Liberal Shadow Health Minister, that they are failing to collect even the most basic data on children who are treated at Melbourne's largest transgender clinic for young people. Now, this revelation comes after a dramatic increase in referrals of children to the gender clinic at the Royal Children's Hospital. Joining me now is the Victorian Shadow Minister for Health and Deputy Leader of the Liberal Party, Georgie Crozier, who raised these questions about the practice in the Parliament this week. Let's start with how this came to your attention. I mean, there's been a lot of discussion. I know there's been frequent stories in the Australian about the real growth in referrals of young people to transgender clinics. We know in Victoria you can change your gender every year, and it can start as young as 16 without parental consent. The latest statistics we saw last year, there were 269 new referrals. That's over 1,300% higher than 2012. Is that what prompted you to sort of ask questions?
Well, there are a lot of questions here, I think, Peter, that prompted me to sort of put to the Minister what is going on in the Royal Children's Gender Clinic. That's a necessary clinic for those kids that are transitioning. I'm not having a beef about any of that. I just want to know the data and what's going on. So I did ask a series of questions, of which I got a blanket response from the Minister to say the department doesn't hold that data. And I thought, well, that's extraordinary, because...
You come out of a medical background, you know that they have that data.
Of course they do. I mean, we report on a quarterly basis. I mean, the Children's Hospital would report medical services, occasions of service, or the numbers of cardiac operations that are happening on a quarterly basis. They collect that data. And what I found so extraordinary was that if the Education Department is giving children information and referring them to the clinic, why then wouldn't the department be collecting that data? And that's my beef. That's the issue that I'm really concerned about, and the secrecy around that. So the more I asked, the more I thought, what's going on here? And why are they hiding this data? I mean, this is about the health and well-being of children. And I think it's really important that we understand what is going on.
And look, I want to be clear too, I am with you. There are genuine children, genuine adults, genuine people full stop, who have issues with their gender identity, and this clinic obviously services those. But that sort of increase, an increase of over 1,000%, is a huge increase. And you've got to see, and this has been happening, as we know, with the Tavistock Centre in Britain, is there some sort of link between the pushing of information out of the education end of the relationship with children and then the appearance or referrals to a clinic? And are we confident that parents and psychologists and other health services are involved in the decision someone is taking to alter their gender? Because it is a massive, massive life-changing decision.
Well, it is, and you know, you don't want to get it wrong, and you want to support those kids that are transitioning, support the parents that are, you know, supporting the children, and giving them the best information that they can have. And I think that we've got a responsibility as governments to make sure that we get that right, and that's why I think it's important that we're open and transparent about these issues as well. And that's why I was asking the questions. And so I thought it was extraordinary that the government was denying that, especially when the Education Department, which was one of the issues I raised about a mother who rang into Neil Mitchell saying, I had no idea my 14-year-old daughter was having all these issues until she was phoned by a school counsellor to say her daughter had identified as male. And you know, that came as a huge shock for her, and then she took her daughter off to see a psychologist and was actually diagnosed as having Asperger's. And so they're the concerns I have, because the schools are giving out information about transitioning and referring children to transgender websites. And I think if they're doing that, then surely we need to understand what is happening in the Royal Children's Gender Clinic, and that's my real concern.
How concerned are you that a 14-year-old child could be well on the way to turning up in a clinic without the parent being told?
Well, I think, you know, these are really sensitive issues, and I think that parents have a right to understand what is happening with their children. And, you know, sometimes the children are they don't want to talk to their parents about these issues, and understandably, but still, they're 14, they're children, and they need to have the right support around them, because these are incredibly sensitive issues, and it's by no means, you know, thinking that this is the wrong thing to do. We just want to give the child the support that they need, and the parent, you know, is very critical in some of these decisions, I believe.
And not so long ago, I interviewed a man. He was one of the governors at the Tavistock Centre. It's the only NHS or government-funded centre of its kind in relation to gender issues for young people in Britain. So only one. We've got one in Melbourne, there's one in Britain. And he was concerned, and he's a specialist in this area, and he resigned over his concerns that there is not enough mental health analysis and diagnosis and support given before the drugs start and the formal process of gender change occurs. That seems a lot like the concerns that this mother raised with Neil Mitchell.
Indeed, and so that's what she was concerned about, and so she took her child to a psychologist to sort of understand what was going on after she was informed by the school that her daughter had identified as male. But could you bear that if that child had gone off to the clinic without that mother knowing what had gone on? That would be absolutely heartbreaking.
And of course, if it's not transgender issues, if it's other things that are affecting a child at school, again, go back to Tavistock, they were telling me that there's a great risk, particularly for women, of fertility issues if you go too far too quickly.
Well, you can't reverse it. I mean, where it's all of those issues that come in, they can't be reversed. And then if people do want to say, well, actually, that's not really what I want to be, I do want to have children, and hormone blockers or whatever have played a part, then I think that's a devastating decision. It's terribly sad, and I think that's what I'm concerned about in terms of, perhaps we need a national peer oversight in relation to what is happening in our gender clinics around the country, so that the evidence-based practices, best practice is undertaken so that we are getting the best results for those children at that time.
And how do you think the government's performing on this issue? I mean, do you feel that the minister just doesn't want to know, or do you think the minister perhaps there's a protocol inside the government not to collect this sort of data?
Well, I'm not sure. I mean, I got the most extraordinary answer from the minister where she said I was engaging in culture wars, and I just find it incredible that they're trying to hide this data. I think they collect it. I've got no doubt about that. Why won't they release it in the interests of the Victorian community, in the interests of those children, and in the interests of the operating clinic, actually, so that we can have best practice, that we are giving the children the best support that they can if they are transitioning, and making sure that's occurring. I'm not saying it's not, but I want to be, I want to know that it is, and that's partly why I was asking these questions and asking for the data.
That's the comeback, isn't it? If you ask questions in this area, you've got an issue with people changing their gender, or you might be a transphobe, any other thing that gets thrown at you. But you're doing your job, you've got a medical background, as I said, you're doing your job as a shadow minister to ask questions. This should be top of mind for a minister and a minister's department.
Well, my belief is this is in the best interests of the child. The child's health and well-being is critical here. And, government's got a role to play. I mean, they have got a very big role to play in some of these decisions. And if they are not prepared to give that data and be transparent and make sure that we are getting it right, then I think that's really concerning. And I think that's why there are so many concerns by parents saying, what information are my children getting?
I want to move to another issue, because announced today by the Premier and the government that they will in Victoria pursue a mental health levy. Now, a levy is code for a tax. Let's call it what it is. It's a tax. But of course, everyone pays into the Medicare levy at a Commonwealth level. They pay a Medicare health specific tax, and that money is then distributed down to the states and to the territories. Some, obviously, medical processes the government pays for at the federal level, and some the government pays for at a state level. Now, if there isn't money for mental health in Victoria, that's because the government's not managing its budget. That's the issue. How do we get to this situation?
Peter, we have seen just a massive mismanagement of the Victorian budget by the Andrews Labor government. They have got blowouts in projects that are running into the tens of billions of dollars. If they hadn't mismanaged that money, that tens of billions of dollars could have been put into the mental health system now. I mean, the government had a report on this a decade ago, in 2009, when Daniel Andrews was the health minister. And what he's saying, it's an emergency now? No, so much needs to be done now. But what we're saying is that money that's been wasted, I mean, the ripping up of the East West Link contract, $1.3 billion, just money gone. That money could have been put into our health system or into our mental health system. We've got a crisis in health, We've got this crisis in mental health, and the government has just mismanaged the budget
Yeah,
so
but at
spectacularly.
what point does the government get out of people's pockets? Because, as I said, there's a range of payments you pay at a Commonwealth level. You already pay levels at a Commonwealth level. Any road you drive on in Melbourne, you pay additionally. You pay a raft of taxes at a state level. After we pay a mental health, do we next pay a public hospital tax or public hospital levy? Where does it stop?
Correct. Well, we are the highest taxing state in Victoria. 25 new taxes, or increased or new taxes, since the election of the Andrews government in 2014. That's not very long ago. 25 new or increased taxes, and this will be the 26th. And that's our issue. We are so highly taxed already. As you say, we pay, toll for our roads. This is just a government that has mismanaged the Victorian budget, and the Victorian taxpayer will be paying for it again and again and again. We're not saying that mental health doesn't deserve funding. It does.
But it's by design that it's a mental health levy and not a levy on, anywhere else in the budget. It makes it hard to argue against. But I think people have had enough.
Well, they have, and my concern is, well, what are they going to do with that money? Is it really going into the areas that we need in mental health? We don't know. We don't know what this levy is actually going to look like, or if the money is going to be directed.
Well,
into
if they
the
don't
right
keep,
places.
I've got to leave it here now, Georgie Crozier. But if they don't keep health statistics in some areas, you wonder where they know where to spend the money on.
Indeed, Peter. Indeed.
Thanks very much for your time.
Pleasure.